Hi, I'm Amanda. I'm going to be your student nurse practitioner. How are you today?
Good. Nice to meet you, Amanda.
Nice to meet you. I'm going to start by testing your cranial nerves, and then we'll move into a head-to-toe assessment. If at any time you're uncomfortable or you feel any tenderness or pain, just let me know. Okay. Oh, I just washed my hands, by the way, too. Okay, go ahead and close your eyes. We're testing cranial nerve 1 and include one nostril. So take your finger and cover one side of your nose, because we're testing smell with your finger.
Oh,
so,
okay.
yeah, like that.
Like this? Okay.
Yeah, include the nostril, yep. Perfect. Okay, and close your eyes. What do you smell?
Eucalyptus.
Perfect. Peppermint, eucalyptus, same thing, great. So patient's left is intact. Include your left, so we're testing your right nostril. Perfect. What do you smell?
Orange.
Perfect. And patient's right nostril is intact, so both nares are patent bilaterally. You can go ahead and open your eyes. So cranial 1 is intact. Next, we're going to test cranial nerve 2, and that I would use a Snellen chart to test your vision, but I don't have that, so I'm not going to do it. Next, I'm testing cranial nerves 3, 4, and 6. You're going to follow my finger. Great, 6 cardinal fields of gaze are intact, and patient's eyes track smoothly. Normally I would do this with pen light. And I'm going to turn off the lights. Okay, so this is testing cranial nerve 3. Direct response, both pupils are equal, round, and reactive to light. Next, I'm testing consensual response. An opposite eye. Consensual response noted. And follow my finger. Convergence, and look away. And look back. And accommodation noted. Okay. Cranial nerves 3, 4, and 6 are intact. Next, I'm going to palpate your jaw. I'm testing cranial nerve 5, but I am also feeling at the same time for TMJ. Clench your teeth. Again. Awesome. And so motor or cranial nerve 5 is intact. Next, I'm going to do the sharp and soft. So go ahead and close your eyes and tell me if you feel, again, this is sharp and this is soft. Soft. Sharp. Sharp. Soft. Great. Sensory function of cranial nerve 5 is intact. Next, I'm going to test cranial nerve 7. Go ahead and puff out your cheeks for me. And frown. Smile. I know. Close your eyes. Really tight. Really, really tight. There you go. Awesome. Cranial nerve 7 is intact. Next, I'm testing cranial nerve 8 with a whisper test. Tell me what you hear.
Whisper. Whisper.
Oh, no, you tell me what you hear.
Okay.
That's a whisper.
A 3, 4, 5.
Yeah. Okay, no worries. Slow. And
6, 7, 8.
Perfect. And if I had tuning forks, I would test Weber for unilateral hearing loss and Rhine on the mastoid process for bone and air conduction. Next, we're testing cranial nerve 9 and 10. I'm going to have you stick out your tongue and say ah. Ah. Great. So I noticed that the tongue protrudes midline, no fasciculations, uvula and soft palate raise midline as well. So 9 and 10 are intact. Shrug your shoulders. 11's intact. And just let your tongue rest in the floor of your mouth. Perfect. So tongue rests midline in the mouth and no deviations to one side or the other. I also can see that your mucous membranes are pink, warm, and dry. Side note, cranial nerve 12 is intact because your tongue rests in midline in your mouth. Okay, so we're done with cranial nerve tests. Now we'll move to from head to toe. At first, basically I'm going to do a look, listen, feel approach. Okay?
Okay.
So first I'm going to feel your scalp. If your hair was down, I would normally have you take your hair down, but your hair is so pretty, I don't want you to. So scalp is any tenderness?
No.
Okay. Hair is equally distributed. Scalp is without lesions or deformities. Patient is normocephalic, and I can just see head to toe that you have appropriate pigmentation for ethnicity. And I don't see any cyanosis anywhere from head to toe. And just looking at your skin of your hands, brisk cap refill, turgor is appropriate, and no clubbing or cyanosis, and the same in your feet. So great, no clubbing or cyanosis down there as well. So I'll wash my hands since I just touched your feet. I really will. Use hand sanitizer. And so next, I'm going to be feeling we're going to do a lot of things. I'm going to feel your temporal arteries, and then I'm going to listen, and then carotid and listen, and then I'll feel all of your lymph nodes and your sinuses. Okay. And then we'll move to eyes and ears. Okay, and mouth, of course. And we'll start with ears here. Okay, stethoscope. Okay. So first I'm feeling temporal arteries. They are +2 bilaterally, and carotid arteries, +2 bilaterally, equal and strong. And next I'm going to feel your ears, so auricles, lobules, and mastoid process, any tenderness? No, next for sinuses. So I'm going to percuss your sinuses. Any tenderness? And also palpate. So I have frontal sinuses and maxillary sinuses. I washed my hands for right before we got here. So fantastic. And now I'm going to feel your lymph nodes around your ears and your neck. Okay. So we have preauricular, posterior auricular, occipital, parotid, tonsillar, submandibular, submental, superficial chain, posterior cervical chain, deep cervical chain, supraclavicular, and infraclavicular. Any tenderness? Okay, no lymphadenopathy noted. Fantastic. And next I'm going to listen for bruits with my bell of my stethoscope. No temporal or carotid bruits, artery bruits noted bilaterally, which is fantastic. Next, I'm going to shut off the lights, and we're going to look in your ears and then your eyes, okay? Okay, let me know if you're uncomfortable at any point, okay?
Yes, ma'am.
Okay.
Yes, ma'am.
So I'm looking at the external canals as I'm putting my otoscope in. Okay, so bilaterally everything looks the same. External canals are without deformities. Minimal cerumen noted, and tympanic membranes are translucent pearly gray. I can see the manubrium of the malleus, and light reflex is in both sides, and the umbo is also present. So those are all expected findings. Alright, this is a little tricky because I have to dial in a little bit. Okay, so next I'm just looking at the external structures of the eyes. Like I said, you're normocephalic, but I see that the head is erect, the trachea and neck, everything is in midline. It looks like your nasal bridge is also. And even distribution of hair, including eyebrows, and your eyebrows are symmetric. Go ahead and close your eyes, and I'm just going to feel Any tenderness?
No.
Great. No masses or anything around the eye, so extraocular eyes symmetrically are have expected findings. Next, I'm going to look in your eye, so if you just look away, you just look straight away, yeah, sorry. And then I'm going to get a little bit close. Okay, great. So patient's left, the fundus is pink. Optic disc is pale yellow or light yellow with well-defined borders. The arterial and venous blood vessels branch away from the optic disc, which is what we expect. And now I'll just take a look at the other side. And you definitely have a red light reflex. Does that hurt your eye at all?
No.
Okay. Okay, and same findings on patient's right. Great. Just have to grab a couple of other things over here. And next, I'm gonna look in your ear, in your ears, in your mouth. Okay. Oh, it broke. Okay. Well, if I had a speculum, a nasal speculum, I would use that to look, but I'll just glance with the light. Again, I can see that your nasal bridge is midline. I'm just going to peek in. Okay, inferior turbinates are located or present and visible bilaterally, but I don't see any bleeding, drainage, or any swelling. Erythema, exudate, none of that. Great. I also forgot to mention when I was looking at your eyes that your sclera are white, your cornea are clear, looks like your iris are brownish, light brown, brownish or maybe hazel green. And yeah, I didn't notice if you could pull down conjunctiva are pink and moist. Fantastic. Now I'm going to take a look in your mouth. Giving me a okay, so awesome. And the patient also has gag reflex. I'm just going to take a look. All teeth are present. Oral and buccal mucosa appear pink and moist. No lesions or deformities noted. I'm also going to feel. You don't have any pain in your mouth or anything, right? Okay. I can also see that your lips are pink and moist as well. And then under the tongue. Perfect. Okay. No lesions or masses, ulcerations or fissures on the tongue or the oral mucosa or buccal mucosa, so those are all expected findings. I'm going to use hand sanitizer. Yep. Next, I'm going to check distance on here. Your corneal light reflex, so yep, perfect. Okay. Patient blinks with corneal light reflex, so that is expected. Next, I'm going to check your thyroid. So I'm going to have you actually turn a little bit this way.
The chair or my whole body?
Just your body. Okay. And I'm finding the patient's cricoid cartilage, and then I'm going to observe you twice. Once just swallowing, so if you want to just take a tiny sip, just observing your swallow. Trachea is midline, no issue swallowing. Again, I'm going to feel the thyroid and right below the cricoid cartilage. Go ahead and take a sip. Okay, and the thyroid is not palpable, which is expected. Fantastic. So I'm looking. You can stay right there, whatever you want to do. Okay. next I'm just observing from the neck down your symmetric breathing, no dyspnea noted, and again, I already did turgor and everything, and skin is appropriate. So I'm just going to take a listen with my stethoscope down. Don't watch my time, okay. This one's kind of fast. And then I will have you, I'll start on this side. So we're doing lift your arm for me just a switch. So I'm checking 3 lobes on the patient's right. Okay. Fantastic. And 2 on patient's left. Typically I would listen a little bit higher, but awesome. If you want to go ahead and turn around for me, like so that your back is facing over this way.
Okay. So here.
You can stay seated. Just
Okay.
turn just like because I'm gonna listen back here.
Okay.
Okay. I can also see that her scapular midline, and she has good posture. Keep going. There's a lot of these. And one more time. Fantastic. So anterior and posterior, as well as lateral lung fields are all clear to auscultation. Now I'm just going to do some percussion. As well as if you want to, you could just stay there and I'll just do percussion. I'm percussing in the front in 4 places, moving laterally and then down. So I hear resonant resonance over all lung fields. Next, I'm just glancing at patient's respirations again, no use of accessory muscles. And I'm going to look at AP transverse diameter. It's about 1 to 2. I also have a tape measure, and I can just use my tape measure to also verify that my estimates are that 1 to 2, perfect. I can also see that the spine is straight as well. So next is going to be tactile fremitus. If you can, every time I move my hands, if you can just say 99.
99.
And I will also do that in the front, if you wouldn't mind just
Turning?
Yes. So many turns.
Thanks.
Normally, if you have a table, it works a little bit better. Okay, and same thing here. You could just say 99.
99. 99. 99. 99.
Okay, and one more time under here.
99.
No tactile fremitus noted anterior or posterior. Fantastic. So this time I will have you turn just a little bit more. Normally we try to limit this. And I'm going to just go ahead and check your axillary lymph nodes. Okay. And I palpate in a linear motion. These are a little bit hard to feel. But so no tenderness, no lymphadenopathy noted. I'm not really pressing as much as I normally would. Okay, so next I'm going to check your pulses from head to toe. So brachial, +2, and equal and strong bilaterally. Radial is the same. Let's see if I can see. Dorsalis pedis and posterior tibial. While I'm here, I'll just palpate for popliteal lymph nodes as well, posterior popliteal. all of your pulses were +2 equal and strong to be expected. I'm going to now test your reflexes. So we'll do biceps first. You want to just rest your hand there. So I'm going to have a reflex hammer. Perfect. So biceps are 2+. Perfect. Brachioradial is 2+. Well, that actually, that's pretty good. So again, biceps. Brachioradial. Go ahead and relax. Mine was doing that earlier. Okay, both patellar bilaterally are 2+. And Achilles are kind of,
Okay.
and Achilles are 2+ bilaterally. Fantastic. Next, we're going to test just a little bit of range of motion.
Okay.
And then I'll have you lay down and we'll do heart and lungs, okay? So range of motion, I'm going to have you do fine movement with your fingers. Flip your hands back and forth. Sorry, I know it's okay. A lot. And then I'm going to have you touch your nose and then my finger. So alternating with both hands, one, obviously one at a time.
Okay.
You're going. You're good. You're good. Okay, so that's appropriate. And I'm going to have you do abduction, adduction, external rotation, internal rotation, supination, pronation. And if you just bring them out and you do the same thing, that helps me see your shoulders. Okay, perfect. Any pain or tenderness in any of the joints? No. Perfect. Go ahead and put your hands like this. Pull, push. So that's biceps, triceps. And then we're going to test quadriceps and hamstrings. So first, if you push out, that's quadricep strength is equal and strong, and pull in is hamstring strength is both equal and strong. So that's fantastic. I also just want to make sure that I noted that your trachea is midline, head is erect, dormus cephalic. And I think we did everything here. So if you want to just hop up here, we will finish. I'm just going to move the camera.
Which way do you want my legs?
If you just have your head on the pillow. Mm-hmm. You're fine. Here. Mm-hmm. And yep, I might just have to adjust a little bit. Oh, let me get you this for your feet. At the end, I'm going to have you hop down and we'll kind of have you walk back and forth and do a couple extra things, okay?
Sounds good.
So, thank you, Sadie. Okay, so, just need it. Okay, so I'm just visualizing, if you can just tuck and pull that down just a little bit, perfect. Just visualizing patient's chest and stomach at the same time, abdomen at the same time. I'm going to start by listening to the heart. I'm going to move a little bit fast, but just for time purposes. So patient's second, finding angle of Louis, second intercostal space. On patient's right, midsternal, just right of the midsternal border, is aortic. Moving over to second intercostal space of left of midsternal border is okay.
Sorry.
Or do you want it?
Nope. You can tell
Okay.
with it.
It's your daughter.
It's fine.
Or I think.
Yeah.
Okay. So second intercostal space, angle of Louis on patient's right was aortic. Moving over to second intercostal space on the left is pulmonic. Third intercostal space, right below that, is Erb's point. Fourth intercostal space, right below that, is tricuspid. And then normally I would sweep up a little bit, but for for these purposes, I'm going to do mid-clavicular line, 5th intercostal space is mitral. I'm also going to listen to the same places with my bell for dull sounds: aortic, pulmonic, Erb's point, tricuspid, and mitral. I don't see any pulsations, but I'm going to feel. No thrills or heaves noted, and this is also point of maximal impulse. So I noticed to auscultation, regular rate and rhythm. S2 is greatest at aortic, and S1 or loudest at aortic, and S1 is loudest at mitral. So next, moving on to the abdomen, I am going to I'm just noticing umbilicus is well circumscribed and no lesions, no pulsations, and I'm going to take a listen in all 4 quadrants. Perfect. I'm going to switch over to my bell and listen for aortic, renal, and iliac bruits. No aortic, renal, or iliac bruits noted to auscultation. And next I'm going to percuss. So let's start down here. Tympany noted on percussion. Now moving to light palpation. And deep palpation. Any tenderness? Awesome. Promise. And I am going to, lost my train of thought. Liver and spleen. Okay, so I'm just gonna have you take a deep breath and breathe out. No tenderness? Okay, take a deep breath in and breathe out. Perfect. No hepatomegaly or splenomegaly, so no organomegaly noted. And on auscultation, and I'm going to just feel for inguinal lymph nodes while I'm here. No inguinal lymph nodes on palpation, and feeling for femoral pulses, and also auscultating femoral pulses. Great, femoral pulses are +2 equal and strong. Next, I'm going to just move into some range of motion, and I'm going to sweep my finger on your feet at the end for a Babinski reflex. So I'm at the angle, but change the angle on your camera here. Perfect. Actually, I'll just do it right now. So toes curl, do not fan, so negative Babinski reflex. Range of motion. Sorry. So flexion, extension, external rotation, internal rotation. Does that hurt at all? Okay. And I'm going to have you move your feet out and in. So eversion and inversion. Perfect. Full range of motion, no issues? No. Same thing on this side. Patient's right. Flexion, extension, internal rotation, external rotation, eversion, and inversion, moving your foot inward. Perfect. And bend your knees for me. And I'm going to have you, you can rest them down and pull in with your knees. Perfect. So adduction and push out with your knees, and abduction are normal and strong. Perfect. I'm going to have you hop down really quick, and we're going to do a quick walk. I know it's hard to move.
You're good.
Okay. If you can just walk back and forth for me normal right here. Symmetric equal gait. Perfect, equal stride, so walk on your heels. So dorsiflexion, perfect, and walk on your tippy toes. Plantar flexion is all normal. Perfect. I think we got everything. Yay.
Good job.
Thank you.